2 years ago, when the administration disbanded the National Security Council's Directorate for Global Health Security and Biodefense, a team that was focused on pandemic preparedness, two members of Congress sent a letter to then National Security Advisor John Bolton asking him to reverse the decision. Quote that letter here. Saving lives from the next global pandemic starts with investing in preparedness before it strikes. We fear these recent decisions will leave the United States vulnerable to pandemics and commit us to a strategy of triage should one occur. They sent that letter back in May of 2018. And look at where we are now. I'm joined by one of the congressmen who sent that letter, Democrat Bera of California. I should note, spent 20 years practicing internal medicine before becoming a congressman. Congressman, why were you focused on this issue back in May of 2018?
You know, we learned a lot in the 2014 Ebola outbreak. You know, the Obama administration got a lot right, but they also had some missteps. What they did, though, was course correct. And one of the course corrections was creating this pandemic preparedness position in the National Security Council, someone whose sole focus was to watch what was going on around the world and be an early warning signal at the highest levels to allow the NSC and the president to know that, hey, there's something to worry about. We saw that work fairly well with the Zika outbreak, where there was an early warning, early preparation, and it wasn't nearly as bad as it could have been. When they eliminated this position, we knew it was putting us at risk, that it was only a matter of time that we were going to see another viral outbreak. We see these periodically, and had that position been in place, they would have been sounding the fire alarm back in the end of December when we first started getting inklings at this.
Did you get a response to that letter?
We never did. John Bolton never responded to us. And we've repeatedly, both Congressman Connolly and myself, have repeatedly raised this issue that you really need someone who's in command and control. As early as January 23rd, when we were first briefed by the administration on this novel coronavirus, a brand new virus, the first recommendation we made, and I made it directly to the administration that was there, was you've got to fill this position with a non-political person, with someone who has access directly to the president and who can work across all the agencies. We lost time by not doing that.
You're a doctor yourself, and you're in a state that started very early with early outbreaks and has actually, again, we don't know if the data is good because there's a lot of pending tests. It seems like it is not on the kind of trajectory that, say, New York is on right now. How do you feel about where things are where you live?
You know, I think Governor Newsom, our local leaders, our public health officials, acting early with the stay-at-home orders may have helped us flatten the curve somewhat. You know, looking at our modeling here locally, we suspect we may see the beginning of our wave here in California toward the end of next week and into the third and fourth weeks of April, and may continue into May. So we're planning for the worst, hoping for the best. But, you know, going back to that early warning system, yeah, we sounded the fire alarms, and many folks did as early as the first week of February. We lost those 6 weeks, 7 weeks to do everything that we're trying to do now. And, you know, we can't get that back. And all we can do right now is follow those stay-at-home orders.
All right, Congressman Bera, thank you so much for making time tonight.